Hi, everyone. Happy New Year. It's January 5th. It's a Tuesday, and this is my daily update for a Tuesday, which I'm going to continue to do on Tuesdays and Fridays at noontime. This is Michelle Gramolia, the president and CEO at Woodland Pond, and I have a few things to go over with you today. We did get a Chanticleer out yesterday, which had a number of calendar items on it. For things to look out for on channel 1340. So please look out for that if you haven't seen it. And I'll hop right into some of the announcements for today. I'm going to talk first about some general announcements on campus. Then I'm going to talk a little bit about our updated COVID counts on campus and testing protocols, just a reminder on that. And then I'm going to talk about vaccines. So I would say we'll be here for maybe 15 minutes today. So first and foremost, I want to thank and offer my appreciation to all of the residents that have signed up to be mailroom monitors for us. The purpose of the person sitting there at the mailroom, as it had been when we had staff manning it, is really to ensure that residents that are waiting to go into the mailroom and then residents entering the mailroom are doing so safely and maintaining 6 feet distance. Unfortunately, we have already seen that the lack of a staff member being there is having a very evident effect on how people are lining up for the mailroom. So we're going to ask that all of you as residents respect the person that's sitting there monitoring and be reminded that the reason that that person is there is to ensure that you are maintaining 6 feet distance in the line as you wait, that you're not piling up and congregating, and that you are entering the mailroom one at a time. We're introducing this opportunity to residents because many of you have expressed a desire to get out and about and do some more volunteer work on campus. But this is a really critical role because that mailroom is very tiny, and we really just cannot have the aggregating of people while you're waiting or congregating there. So we're hopeful that this program will work with resident monitors, but if not, we will have no choice but to put a staff person back in place there. This is one of many things that as we go forward and as we look to returning to life as normal after we're vaccinated and once we get through the holiday rush of cases, that we're really all going to have to be so self-aware about our space and distances. We're not going to be able to revert to the way things were before. We're still going to have to maintain the 6 feet distance and always wear the masks. This mailroom, I don't want to call it an experiment because I'm hoping that it's going to stick, but we are immediately seeing that without a staff member being present, old habits are coming back. So this is a reminder that 6 feet distance from anyone that you're speaking to is the distance of your entire arm, so your entire arm's length plus theirs. You two should be far enough apart in all directions that none of your hands would touch if you put your arms out straight. So please keep that in mind. That's what 6 feet is. In terms of masks, this is a friendly reminder that anytime you are anywhere indoors at Woodland Pond outside of your primary residence, whether it be in the lobby, in the fitness center, in the pool room area, unless you are physically exercising and you are alone, you should have your mask on. So if you happen to be in the art studio for some reason, or in the pool room, or tidying up a shelf that you see somewhere on campus, if it's in a community space and it's not your home, you need to have your mask on even if you're alone. Obviously, the exception would be if you're working out in the fitness room or if you're swimming in the pool. But as you're traversing within the pool room, you should have your mask on. If you are certainly in the lobby or in the mailroom or walking in your hallway for some exercise or sitting in your lounge, you should have your mask on. This is very, very critical. And we are going to be asking you again to really pay attention to that and be attuned to it. because as we do start to be able to reopen things over the next several weeks, again, once we're through the period of time post-holiday, it is going to be incumbent on all of us to ensure that our behavior is as safe as possible. So please make sure you're wearing your mask, even if you're doing a solo activity, with the exception of if you're doing physical activity in one of the assigned spaces. The concierge has asked that anyone that has excess masks that are Woodland Ponds lying around, we need those back so that we can sanitize and launder those and get those back into circulation. I know that a lot of you have been purchasing your own masks, or your family members have been sending them for you, and that's fantastic. You do not have to use a Woodland Pond mask. You certainly can use your own masks, and at this point they're readily available just about everywhere, certainly online. They're at the drugstore, they're at the gas station. Buying your own masks that you feel comfortable with and laundering is perfectly fine. We would ask, of course, that they are real masks and not a piece of cloth. We have continued to see some things that would certainly not be recommended by the scientists. A piece of cloth or a bandana is not considered to be sufficient. It really should be a mask. And face shields are not sufficient because they allow for particulate matter to come out of the bottom of the mask. If you are out of the shield, if you do choose to wear a shield, you must wear a mask with that shield. So that becomes a little bit cumbersome. But if you do have masks, if you could bring them to the concierge, if they belong to Woodland Pond, so we can launder them and get them loaned out to people. Let's see. The next thing is that it's just a reminder that at this point in time, the campus remains closed to all visitors, with the exception of very limited cases where we are allowing compassionate visits. Compassionate visits are for those folks that are generally experiencing a terminal illness and facing potentially not being able to recover from that illness, and that requires my explicit approval. So if you are having folks come to campus and visit you, you should not be. Only those people that are either approved caregivers and have a badge saying so, or those that are coming here with an approved compassionate visit should be on campus. This is extremely important. Cases of COVID are up all over the place, and we continue to hear that the #1 place that COVID is being transferred is right inside our homes, in our living rooms. It's not necessarily in the grocery stores because people are keeping their distances and sanitizing. It's where we get too comfortable and we've got someone that we have not seen in a while in our living room, taking our mask off, visiting with us. So for the time being, because we are in such a high risk time period right now, we are remaining closed to visitors. If you feel that you have a physical need that requires you to have a caregiver approved to provide you with hands-on physical care or support in your home or apartment, and this is independent living only, you may contact me or concierge, and we will give you the paperwork that explains what's required and how that person could become approved. For those that are seeing passionate visit, our administrative team comes to me, we discuss it, and we make arrangements for such compassionate visits. When we do those visits, we do rapid test the visitors right on site here. We've got our rapid testing capability has grown. So that's a very strong protection that we are able to offer. And then those visitors are permitted to visit at the bedside of the resident with full personal protective equipment that is provided to them by Woodland Pond. And then once they're done with their visit, they do leave. There are, of course, limits to this. The state is extremely particular about how often and how many people we allow for a compassionate visit, but certainly, we expect and anticipate the need for that to continue. So that is just something for you to be aware of. For those that do have approved caregivers in independent living, we have seen a concerning number of folks that are coming into the building, not through the concierge desk, and that cannot happen. If you have an approved caregiver and that person is coming on campus, they must 100% of the time be screened before coming to your home. That's whether you live in a cottage or an apartment. So if your caregiver is coming at a time that the concierge desk is closed per se, there are instructions on the front door as to what that person is supposed to do. They will need to be screened by a health center reception staff member or a security staff member, and then escorted to your home in independent living once that is completed. We cannot have, under any circumstances, any non-Woodland Pond resident coming through any of our side entrances. We are ethically and morally beholden to all of you to be able to say that we are doing all that we possibly can to keep COVID off campus. And the way that we can do that best is by controlling the flow of traffic into the building. We recognize the need for the approved caregivers, of course, and they're welcome, subject to all of the requirements. They've got to get tested, they have to be screened, etc. But this program will only work if the caregivers are coming through the main entrances. We have to be able to screen them. If you are running into a challenge or you have any questions about that, please contact me right away. We are very careful about knowing who's in the building at all times and making sure that we can sleep soundly knowing that those people have been screened and are being tested if they're required to be. And we really need everyone's cooperation with this so that we can continue this program. And ultimately, it's going to be the success or the continued success of this program that's going to allow us to resume visiting on different parts of campus, as permitted by state regulation. So please, we really need your help with that. Christy has asked me to remind you of a few billing items. So first and foremost, we had announced kind of throughout the second part of 2020 that because of the interruptions in the dining program, we were going to do a one-time allowance for folks to carry over $300, which is a full month's worth per person of declining balance, into 2021 for you to use throughout the course of 2021. You were all great about understanding exactly how much you had left and kind of keeping that in mind, but there still have been a few questions in the last couple of days. So please keep in mind that everyone was permitted to carry over per person an extra $300 going into 2021. So everyone started the first of the year with $600 versus the $300 that you normally would have, and then you'll be able to carry that and use it throughout the year. You heard me say on the last update that Ronnie and her team have been sitting down to really look at revamping the cycle menu, as we have to do every few months now, and looking at introducing potentially some live food service options for you. So please stay tuned to that. For those that have feedback on dining program and things that you'd like to see, kind of keeping in mind what we're working with here with doing as much prepackaged right now as we have been, please contact Ronnie. Email is best, but if you don't email, her extension is 5711. She wants nothing more than to provide as much satisfaction through the dining program as possible, and your feedback for that is critical. Let's see, one more just housekeeping type item. Oh, I'm sorry. Christy also asked me to mention that Melissa, our billing representative, is out of the office for a couple of days, and so the bills will be going out closer to the end of the week this week. So we know that you have not gotten your bills yet, and they will be coming out towards the end of the week. And finally, for all of you that, for whatever reason, in independent living end up in a quarantine status because you've gone off campus or you're concerned about illness or you've had a medical procedure, we're carefully tracking all of that, and you should be contacted and you should be made aware of how long you need to quarantine, when we will be around to test you. We come around with First Care on Mondays to test at your independent living homes. So any of you that are quarantined should be getting that communication from Mary Jo. We keep a very specific calendar as to when those tests will happen and what your quarantine release date is. There seems to be a little bit of confusion about what it means when you're on quarantine, but if you are placed on quarantine for any reason in independent living, you are quarantined for 10 days. That came down from 14 2 weeks ago when the governor changed his guidance. that you need to quarantine for 10 days and have a negative COVID test based on a schedule that we provide. When you are on quarantine, you cannot leave your independent living home except to go outside for a walk, and you should use the entrance closest to your apartment. If you have to go to the grocery store, go to the doctor's office, do so with caution, but on campus here, no community activity. Please don't come to the concierge. Please don't engage with folks. When they drop off any deliveries or meals to you, please do not plan to come to the fitness center or the pool. You are on quarantine, and it's for a reason. It's because you've had some kind of exposure that we don't want to spread with on campus. So please, if you have any questions about that, you can reach out to me or to Mary Jo. Okay, so that's the announcements that we have for today. Now, as to where we are with COVID, we are stable with our numbers, knock on wood, head count wise. We have had some people come off the head count positive and some people go on the head count positive, but our number has been either 5 or 6 positive cases on campus between staff and residents consistently for the last 6 or 8 weeks, which is fabulous. We are being very, very careful about keeping any staff member that has had any known or suspected exposure to someone that has tested positive, keeping them off campus. We are paying those folks to stay off campus for the full quarantine period that they need to, and then be tested negative. We're really just trying to do everything we can to keep this campus as virus-free as possible. So we're very happy with where we are right now. As you know, the residents that have tested positive over the last really several months, there have been none that have been symptomatic of COVID. So yes, we have had positive cases as a result of routine testing or exposure, but none have really developed the symptoms of COVID at any point in time. We did have one resident that had gone to the hospital for adjacent related reasons. She is continuing to work through her COVID shedding process and is expected to come to skilled nursing soon. We had another resident that ultimately went to the hospital for a cardiac related issue, and then while in the hospital appears to have contracted COVID. She also is in the process of being able to come back and come into the rehab setting, but we're not seeing, knock on wood, cross transmission between units. We are not sharing staff between units unless it's an emergency, and in that case it's only non-direct care staff. So really trying to be as careful as possible. The light is at the end of this tunnel. I feel very optimistic and excited about what the future is going to bring. We got a couple of weeks to get through here till we can really start talking about reopening things. We need to keep a very close eye on how case counts look over the next 2 weeks or so here in Ulster County. And then, we're excited to be able to start making some decisions about what we can safely resume doing on campus. And a big part of that is going to be vaccines. So we are in vaccine week at Woodland Pond. We will have our first almost 150 people on campus vaccinated with their first inoculation on Friday of this week. We have been all hands on deck getting everything organized for that vaccination clinic, and we are extremely excited. We are even more excited that as of this morning, we have now 3 dates in hand for assisted living vaccination clinics. So once we get all of our ducks in a row for the independent living for the skilled nursing clinic, which is Friday, we will then immediately switch gears to start getting all of the consent forms and information out for the assisted living vaccine clinics. But the very first date of the first assisted living vaccine clinic, which would cover assisted living and Garden View, and any other remaining staff members that wish to be vaccinated, is going to be on January 24th. We are waiting for confirmation right now as to which of the vaccines that will be. And I think, as you all are aware at this point, whichever vaccine you get for round 1, you have to get the same vaccine from the same manufacturer for your second vaccine. So, for example, we have our skilled nursing vaccine clinic. The first round will be this Friday. those are the Pfizer vaccines. So on the 29th, all of the people that are vaccinated with round 1 this Friday will come back on the 29th and have their second Pfizer vaccine. And then 2 weeks after that date, those folks will be considered to be inoculated. For assisted living, the first round will be on the 24th, and then we've got the second round on the 14th of February, and then they gave us an additional date in March. So we expect that the dates are just going to kind of keep growing, so that as we get new admissions, as more people decide that they want to be vaccinated, we can just keep continuing to vaccinate folks. We still do not have concrete information on independent living, as comes from the Department of Health. I continue to reach out to private enterprise and local community medical providers to find out what our opportunities might be for getting independent living residents vaccinated. And I'm still not getting much conclusive information. There have been some logistical challenges, as is starting to become very prevalent in the news cycle, about the deployment of vaccines and vaccines that have been distributed to the states but are not making it to the individual level. And I think that over the next few weeks, that's going to start to become a really high, first of all, a hot topic in the news, but also a high priority. Governor Cuomo yesterday said that, it's really his priority to make sure that everyone in the nursing home environment or skilled nursing and the assisted living setting throughout New York is vaccinated within 2 weeks. As I said, we have our first assisted living vaccination date at the 24th as of this morning. So it looks like this is going to start to really become, a more all hands on deck type situation at the state level. For independent living folks, what I would ask of you is to please be reaching out to your MD, your primary care provider, and ask them what information they can provide you about being vaccinated yourself. And if you find any success in that, or you get any positive information about actually being able to access a vaccine through your MD, if you could please let me know, that would be enormously helpful. I'm trying to understand what the opportunities are through whatever Woodland Pond can organize, through the state, and what you're able to access individually, so that we can really start getting these vaccinations to the independent living residents. What I have heard in independent living is very similar to what we have seen now so far in skilled nursing and assisted living, which is that that folks are really, the residents in particular, are very excited and very anxious to be vaccinated. I think it's great. Getting vaccinated is the only way we're going to get through this, and so this is a enormous and exciting opportunity, and I know how excited you all are about getting vaccinated. So I want you to know and hear from me that we are doing everything we can to identify any opportunities for vaccination for everyone on this campus that chooses to be vaccinated. So that's where we are. I will post a link to this video on our YouTube channel shortly after we're wrapped up here. If anybody needs anything from me this week, please reach out. Friday, I'm going to be in the health center, as a lot of us are going to be, safely distanced, coordinating and ushering the vaccination process to assist the folks from the CVS Pharmacy corporate that are going to be here actually vaccinating. We're very excited, and I'll talk to you all on Friday. Thanks.